And I also think a lot about, and the book actually concludes with a plea for considering harm reduction infrastructure and considering how we could infuse the tenets of harm reduction, the philosophy of harm reduction, and the very concrete and pragmatic things that harm reduction means into our healthcare system. But I do wonder, because now we are all thinking a lot about harm reduction, and it seems to me like we need our harm reduction, our very articulate activists and harm reduction spokespeople, we need to listen to what they're saying about the ways in which within all of our lives we can minimize harm. We have many harm reduction regimes out there. Okay, seatbelts, helmets, and every time, whenever those were instantiated and brought into being, there was protest. People thought it was an infringement upon their freedoms to ride around without a helmet or to not wear a seatbelt while driving or in a car. And so harm reduction is always going to have that public healthy, kind of convergence. But the harm reduction activists who I looked at, you would never look at them and say, hey, they're staid public health, sort of button down public health people. I mean, they're people who are saying, let's look how people live. Let's look at how they take pleasure. Let's look at what people make of the lives that they have within their current social and economic conditions. Let's look, at the very basic ground level at what people need, what they actually need in their lives to stay alive. Naloxone became a need, and in a way, harm reduction narrowed to the point of naloxone. But harm reduction is ever so much bigger than naloxone. Naloxone alone cannot solve our opioid overdose crisis, and a mask alone cannot solve COVID-19. We have to evolve social infrastructures for responding to these kinds of epidemics. And I think that's what we're in the process of doing, and hopefully we will do it well, and we'll listen to our harm reduction activist friends who have a lot to say about how we could do better.